Emily. I'm going to be your nurse. I'm just here to perform a basic assessment on you. We'll go head to toe through your body systems, okay?
Okay.
The quickest way to start is we're going to get your basic vital signs. If you don't mind standing on the scale, and we'll get your weight. Oh no! Okay, so thank you very much for that. And if you stand up against the wall, I'm going to get your height too. Okay, so we're measuring right about 5'8". Okay, you can sit back down. I'm going to quickly get your blood pressure, okay? And to do this, we'll get your heart rate as well.
Okay. It's bound to be high because the weight certainly was.
Okay. So we want to make sure your legs are uncrossed, your feet are flat on the floor, okay? We won't talk during this because that's where we get the most accurate reading, okay? Just breathe normal. About 128/75. Is that comparable to what you normally get when you go to the doctor?
Yes.
Great. Your respiratory rate was about 18. I'm going to real quickly check your heart rate. Your heart rate was 64. Okay.
So are those numbers okay?
Those numbers are okay. We look anywhere from 60 to 100 as being a normal heart rate. Your systolic, the first number of your blood pressure, was a little high. We normally want to stay under 120 for the systolic
What
part
was
of your
mine?
blood pressure, 128. But those are, it's not considered a hypertensive emergency by any means.
Okay.
So next we're going to go from our head to toe assessment, okay? We're going to start first with your skin, okay?
Okay.
So just looking over your skin, it appears to be moist and dry. There's no odors. I see no abnormal moles or birth. You have a birthmark right here. Has that changed at all recently?
No.
Okay.
Been like that for years.
All right. And just looking underneath your arms. All right. And notice the patient has good elastic skin turgor. All right. I see no signs of any pallor. And I'm going to check your scalp as well, okay? The hair is nice and evenly distributed. It's coarse in texture. I see no dandruff at the scalp. Alright. So the next part of our assessment, I'm going to look at your fingernails. I'll defer from your toenails because they are painted. But looking at your nails, do you have arthritis in your fingers?
Probably a little bit.
A little bit, yeah. But the cuticles are intact and healthy. Nail beds are pink and even. I see no pigment feel that one's normal as well. I can also take the bell of my stethoscope and also take for any bruise.
Any what?
Which is normal. I do not hear any. For your neck, I see the trachea is midline. I see no bulges. I'm going to check your thyroid gland real quick. If you could just swallow for me. Okay. I feel the thyroid gland when she swallows. It's not abnormal. No bulging there. I can feel for your lymph nodes as well. We have the submandibular lymph nodes, the submental, the deep, cervical, and occipital, have superficial and posterior cervical, and supraclavicular. And I don't feel any left endopathy in any of those lymph nodes. Everything appears to be normal. I can also feel for the carotid pulse in the neck. Alright, and those are both normal, and I see no jugular vein, no JVD, no distension of the jugular vein. So moving on from the neck and lymphatics, I can look at the eye, the nose, and the throat. So looking at the patient's eyes, the external of the eye, I don't see any masses. I see nothing that makes me think she would have a sty or any infection of the eye. It's free from drainage. Her pupils are symmetrical. I'm also going to check what we call your 6 cardinal gazes. So you can just follow my light, okay? And I'm just checking to make sure that both of your pupils are moving in the same direction, okay? Leave your head still. Very good. Okay. So we'll put that down. I can also test to see how your pupils react to light. By shining the pen light across the pupil of your eye, I'm just going to look for it to constrict. Okay, just kind of brighten this room, but they should still have some constriction left. Okay. And I see equal reaction in both eyes. I'm going to defer touching the eyeball for this test. I can also test the nose. Do you feel either of your nostrils are stopped up at this time?
No, I feel okay right now.
Okay. Alright. So I'm going to grab something for you to smell. We're just going to check and make sure you have the sense of smell in both nostrils, okay? Okay. If you would cover your left nostril and tell me if you're able to smell this.
Yes.
Okay. And this is nail polish. And with this nostril.
Yes.
Okay. So it appears that the sense of smell of the patient is intact. This also is our first cranial nerve, the olfactory. So moving on to the respiratory system, I can look and watch the patient breathe and notice that she has symmetrical chest rise and fall. She doesn't appear to be any distress with breathing. I just listening with my ear, I don't hear any audible wheezes. She's not coughing. Reports no recent productive coughs. denies any trouble laying flat to breathe. So the first thing I can do before I listen is I can palpate, or no, I can listen then palpate, I'm sorry. So we're going to listen on each sides of your chest, okay? And every time I ask, if you would just take a deep breath in and out.
Okay. Let me sit up.
Okay? So we're going to start with the anterior chest. Okay. And I'm careful to listen in the intercostal spaces and not to place my stethoscope on top of a rib. Okay. Take a deep breath. Okay. And let it out. Okay. And again. Okay. You don't have to breathe that deep because I don't want you to get short of breath by the time we're finished, okay? And again. Okay. And in the center of the chest, I do hear more of a bronchial sound. All right. And here. Okay. And then for your left lung, anterior. Okay. Okay. And again. Okay. So for the right middle lobe, I'm going to listen laterally. Okay, breathe. Okay. All right. And the lateral side of the left lower lobe. Okay. And then at the bottom. Okay. All right. One more. Okay. And then I'm going to go to the posterior right lung. All right. And again. Okay. I'm avoiding placing my stethoscope right on the top of her scapula because it will muffle my lung sounds. All right. And again. Okay. And the posterior aspect of the left lung. Okay. Okay, great. And just palpating. Is any area sensitive on your lungs or rib cages?
Mm-mm.
Okay. Great. Okay. So the patient's lung fields are clear and equal bilateral. I hear no evidence of wheezing or crackles. I hear no rubs. The next thing I'm going to ask you to do real quickly, I'm going to put the stethoscope back on, and we're going to do a couple theories. I'm going to ask you to say the word E. I'm going to ask you to say the word 99, and then I'm going to ask you to whisper. And I'm going to look to make sure that I'm hearing the same thing, okay? And this is testing for any type of lung consolidation that might warrant further inspection. Okay, so say E.
E.
Good. And again.
N.
Okay, and if you could sit up again. All right. E.
E.
And again.
N.
Okay. And what I'd be looking for is if I was hearing like an A sound come through, which I hear nothing of that. I just hear the E mimicking again. And we're going to do the same thing for 99.
99.
Okay.
99.
Okay.
99. 99. 99. 99.
Okay. And that is a muffled 99, which is the normal finding. I don't want to hear what the patient is speaking in the same terms, because then that would confer consolidation as well. The last is I'm going to ask you to whisper 1, 2, 3, okay? All right. 1, 2, 3. Okay. 1, 2, 3. 1, 2, 3. All right. 1, 2, 3. Okay. And that's normal as well. I don't really hear this. I see her whispering, but I don't really hear it coming through her lungs. So moving on to the cardiovascular system, it's one of the most in-depth systems of the body, because we have the peripheral vascular system, which looks at how your blood's pumped through your veins and your arteries extended off from the heart. And then we also look at the heart itself. So just a visual for the heart and the peripheral vascular, I see no varicose veins. Looking at the patient's chest, all of the the veins on her chest appear normal. None of them appear distended. I see nothing that would alarm me to any kind of a venous stasis or anything. There's no swelling on her ankles that would make me think maybe she was retaining any type of fluid related to like congestive heart failure or any symptom like that. I've already palpated her temporal and her carotid arteries, and I've gotten a normal finding. I could also do her radial arteries, which I did with her pulse, and that had a normal, just a 2+. I could do the left radial. I could do bilateral brachial pulses, which are a little more tricky to find. Okay. The popliteal behind the kneecap, I'll defer this one, but it should be the same. I will check her dorsal pedis and her posterior tibial. And this is a good strong pulse here. Once again, it's 2+. It's not bounding. It's not faint. And the same thing with the left foot. And then the dorsus pedis. Is normal as well. Okay, so that pretty much concludes the vascular system. It doesn't appear that she has any, wounds on her feet or anything that aren't healing. Everything looks to be in good shape. I will go on to listen to the heart. So I can use the bell of my stethoscope for this, where I use the diaphragm to listen to the lungs. Now listen to the S1, 2, 3, 4, and 5. And I just want to listen for the normal left dub. I don't want to hear any murmurs, any gallops, any rubs. Once again, I want to be careful I'm listening not on the rib, but in the intercostal space. I can also listen at the apex of the heart and feel her pulse and make sure they're in alignment. Which it does appear to be. Okay. So the next part, I will look at the patient's abdomen. If I could have you in this part, I'm just going to have you lie on the bed. We'll position you comfortably. You can use a pillow if you like. Okay, just a little technical difficulty. Okay, so I'm just going to pull the shirt up just a little bit, okay? I just want to make sure I don't see any pulsations on the abdomen, which I don't. That would indicate any kind of abdominal aneurysm, anything like that. And it looks even. So the patient's stomach appears to be normal in all 4 quadrants. It's relatively flat when she lays still. Going to listen in all 4 quadrants for vowel sounds. Once again, I'm using the diaphragm of my stethoscope. The vowel sounds are pretty hyperactive, but the patient did just eat a large meal. And while she's lying on her back, I can percuss on her abdomen to determine So I do notice the different tone as I percuss over the liver. And I'll refrain from doing any type of a deep palpation that could show any type of tenderness, okay? And you can sit back up.
Was that bad?
If it was, if it was abnormally tender, it could be bad. I can also check the costiver angle. Okay. Are there kidneys? Is any of that tender to you?
Mm-mm.
Okay. So all that once again appears normal. If at this point we were going to do a breast exam, which we're not, I can teach the patient how to do a self-breast exam at home. I would instruct her to put her arm above her head, and then she can start in this part of her skin right here, and you just want to massage it gently and feel for any lymph nodes or any masses that don't feel normal. Then there are various ways of assessing the breast itself, but what I found the easiest is to go in a circular motion, working from the outside in, really taking special care to feel deep within your breast for any kind of lumps or